Dr. Collins, I could see you earlier, but I couldn't see what was in front of me. It's nice to be able to see both. Thank you very much. Thank you for you being here, your colleagues. Dr. Collins, you were in my office late last week, I guess it was, and we had a conversation. I want to ask you to follow up on the conversation that we said, kind of if someone can humbly give you an admonition, I tried to give you one. And you talk about in your testimony the stewardship initiative at NIH. In my view, they're related. And I want you to tell us again, tell us in more detail about what you're indicating in your testimony about stewardship at NIH. But I want to reiterate what I indicated in my office. Many groups, people, individuals, folks afflicted by every disease ask members of Congress for help at NIH to find a cure and a solution to their health and their lives. We have taken the opportunity to defer to NIH to make the decisions about prioritization of medical research. The theory, I think, has been, before I arrived in the Senate and became involved in this issue, the theory has been that scientists should make the decisions about where the most promising opportunities are in finding the cure or the treatment. But what I want to know from you is that you are fulfilling that responsibility, that NIH, in the absence of Congress's direction about where to focus the dollars, that NIH is making the best decisions possible to find the cures that are the most readily available and most demanding by our citizens and the population of the world. In other words, if you don't do that prioritization, then I think it's going to become incumbent upon Congress to make decisions that are better made by you.
Senator, I appreciate your raising this issue. It's a very important one. And even as we hope and pray for a lifting of sequester caps that would allow NIH to get back on a stable trajectory, as well as many other important activities of the government as well, we take very seriously the importance of enhancing our current focus on stewardship to be sure that we are paying absolutely close attention to how every dollar is spent. And so over the course of past many months, sort of looking at areas of that sort, we have, in fact, quite a vigorous plan here in terms of how to put forward those stewardship initiatives. One is to develop an overarching NIH strategic plan covering our entire 27 institutes and centers, each of which has had its own strategic plan, but we've not had those synthesized into an overarching document that can guide our priority decisions. And we will have that, and we'll submit it by next December. We also can use new methods that are actually much more sophisticated than what we've had in the past to do a portfolio analysis and see exactly where are our dollars currently going. Are there gaps? Are there areas where we've piled up things in a greater proliferation in some spots and not enough in others? We are going to look closely at our portfolio of HIV/AIDS research and see whether, in fact, now that it's 2015, we desperately need to find an answer to this disease and to end this epidemic. We need to focus particularly heavily on vaccines, on new forms of therapeutics, on potentially the cure, on comorbidities. We have an active grant-by-grant review going on right now of our HIV/AIDS portfolio to see how that matches with the priorities that should be most appropriate at the present time. We're going to make sure that we have best practices for how funding decisions are made within the institutes, because peer review is part of that, but not all of that. We have to make decisions based upon scientific priorities that our councils and our directors are responsible for, and we want to be sure we're making the most of those opportunities. We will continue to look for partnerships so that as much as possible we can find other dollars besides the NIH dollars to pursue important scientific projects with other agencies or with the private sector. We'll certainly focus intensely on early-stage investigators, which have already been raised as a major issue and one we're very concerned about. How could we enhance the opportunity to give those early-stage investigators the confidence that there's a career path for them and they can take risks and do innovative research without fear of losing support? And as was mentioned by Senator Alexander, we're going to look closely at administrative burdens, many of which we don't control, but for the ones that we do have some say over, we're going to try to do everything we can to reduce those and give scientists more time to do science instead of paperwork. That's a partial list of what is actually quite a vigorous array of activities, but I want to assure you very much from my own personal commitment here that we are taking this with great seriousness. We don't expect people to say, oh, well, you're just NIH, so you deserve dollars. We have to show that we're using those wisely and that every dollar is being put to good use. And there'll be much more to say about that in the coming months.
Well, I think, as you heard from Senator Durbin and really every member that's spoken, we're interested in finding additional resources for you. We understand that this issue cannot be resolved only by your efficiencies, but as we find those additional dollars, the assurance that I am looking for is that you then have the capability to make the decisions where those dollars can best be spent for the best outcome for the health and well-being of our country. And I thank you for your answer.
Thank you, Senator.
Thank you, Senator Moran.